All right, let's move on to indirect method of digital radiography 2, or the second indirect method. This one uses cesium iodide and amorphous silicon, or ASI. So again, as a reminder, if we're talking about an indirect method, what it indicates automatically is that the extra step of scintillation is involved. What this means is X-rays are converted to light and then an electronic signal. Remember, that could also mean a loss of resolution. So with this method, the capture element in this case is the cesium iodide. So this is a phosphor that captures X-rays and emits light as a response. And it is the scintillator in this indirect method. But now, for the coupling element, we have amorphous silicon. Amorphous is another way of saying that it can be painted on, so it's basically kind of a fluid. And it is a photodetector. Then the collection element is an active matrix array involving TFTs and detector elements. Going too far into these different elements is beyond our scope of practice, so we just go into the basics. So let's take a look at this schematic here involving cesium iodide and amorphous silicon. Now, these components are basically all compiled or organized almost in the way pixels are. So they're each kind of tiled together like we saw in that previous indirect method. So let's take one of these out. If we separate it out, what we can see is we have these electronic components here, but the majority of the area of this kind of pixel looking thing here, or the detector element is the best word to use, or words, sorry. The majority of the area is going to be the actual detector, which is that amorphous silicon. And then over here we have a storage capacitor and things like that. So we need a little bit of space for the electronic components, but we want to use as much space as possible in each one of these little tiles for actually detecting light and getting information about anatomy, basically. So we have what's called a fill factor. So as the size of the pixel decreases, or as these things get smaller, spatial resolution increases. However, patient dose also increases because of the reduced fill factor that each small pixel has. So imagine you have this size of a pixel or detector element, and we can use this much area, 80% of the entire thing we can use to actually get anatomic information. The rest of it has to go to these capacitors and the TFTs and so on. Well, if we make this smaller, we can get better spatial resolution and finer detail, but in the meantime, that means we need more overall of these electronic elements, and then we have less overall space in comparison. So the fill factor is just a way of expressing how much of each pixel is used for actual light collection, so actually getting information.